Greetings and
Good.
salutations, everyone. Welcome to the webinar. Today we're going to be discussing Oscar plans, and we're just going to slow walk this as everybody kind of filters in for the webinar. Brad and I are going to go through a few slides, and then we'll get started with Jared. So Oscar Health Plans is the order of the day today, and you know the drill. If you got a question, you'll put it in the question box. And I do ask that maybe some of you or all of you, if you need to be, just go on the question box and say that you can hear us loud and clear and everything's coming over clearly. You know, there's always issues every so often. We've got a new system update, and so things should be working just fine. And say good morning, Brad.
Hey, good morning, everyone. Thanks for joining. Glad to have you here.
Fantastic. And we are the dynamic duo of the individual market. Sometimes we call ourselves two bald men talking insurance, but I digress. But and you know, here's our information. We know everything you'll need to know about the individual insurance market, and we're so delighted and honored with the history and partnership that we've had with thousands of Cornerstone brokers over the years. And we're so delighted that you could join us today. And I'm going to flip things over to Jared. Jared, are you on the line?
Yes, thank
Jared
you, Jeff.
Wassley. Okay, fantastic. I'm going to make you the presenter, and we should be off and running.
Great stuff. Thank you so much, Jeff and Brad, um, for allowing us to speak with everyone this morning. Much appreciated having your time. And what we'll basically be going over is just sort of a summary of what we presented last year, and obviously with a couple 2024 adjustments, and I can give a little bit of forward insight going forward as well. As many of you might know me already, my name is Jared Wastley. I'm a sales lead here at Oscar. I run our mid-Atlantic markets, at least that's what we call it. So we include Ohio, some of our Northeast states, Georgia, Tennessee, kind of under that umbrella. But obviously, Ohio is a huge part of our portfolio. It's a massive priority of ours as well, and we continue to grow in that market. One of the things that we've always kind of spoken about, really pushed, is utilizing technology with the member-centric approach. And one of the reasons we do that is we want to drive cost savings for members, but we also want higher satisfaction. So we often present an NPS score or Net Promoter Score. Ours is always above 40, which is uncharacteristic for insurance products in general. Usually those are in the single figures. And that's really what we want to drive. We want to build our own technologies, our own sort of workflows, try to find ways to make that experience with your insurer better, easier. I think we've done similar things as well on the broker front too, on some of the tooling we've built out. And that's essentially because we want to have the sort of high satisfaction level from members. We have a direct correlation between that, cost savings, and also a better member retention, and even brokers having better retention as well. Kind of on the sort of snapshot, this was, as I mentioned, this was prepared last year. So just before open enrollment, we were just around 1 million members. We were in 19 states, 18 of which in the individual space. We're actually at over 1.3 million now. So we, have been around sort of, I think 2018 was when we launched, or end of 2018 when we launched our partnership with Cleveland Clinic and that joint venture. About a year later, we expanded into Columbus. And then if you recall, last year, we expanded into Cincinnati as well. So as we've kind of grown our overall portfolio, we've also grown a lot in the state of Ohio as well. So very, very happy to expand. And we thank everyone on the call for allowing us and helping us reach these milestones as well. So as I mentioned, 19 states, 18 of which on the individual side, almost 600 counties. We have employees really across the country. Our headquarters are still in New York. We have an office in LA. Most of our sales force actually lives in Florida, so we kind of all spread out all over the place. We have team members in Arizona as well, and very much a national participant in the ACA space. Next year, we are likely to just stay within the same the same state areas, and we're looking at expanding, kind of like what we did last year with additional counties. I know we'll be adding a few in Ohio as well, and that's kind of what we've really enjoyed doing, and we've found a lot of success is adding, a major metro in a state and then expanding from there once we have a better idea of, where are we competitive? What do we want to look like? Where can we, grow, and where do members need more sort of competition as well? As I mentioned, I spoke about engagement, technology. We really do this through a means of building our own product, and doing that allows us to make it as easy as possible. So, for example, everyone's talking about sort of telemedicine, especially during COVID and afterwards. Well, this is something that we've had since 2018. We've always believed that, teledoc, having your own experience, is kind of the way forward to drive engagement, drive affordability for members. And that's kind of what you've seen us overall. Some states, we also have a virtual PCP option that's not yet available in Ohio. Hopefully we'll have that soon. But this will continue to be a major part of our experience. We obviously know how important in-person care is, but for affordability, for time saving, this virtual option is always going to be a large part of our offering. So on our product portfolio side, if you recall, obviously the big thing was, the limited plan portfolios for all carriers. So one standard plan and then a maximum of 4 additional per metal tier. There wasn't really anything unique in what we did in Ohio. It kind of tracked similar to most of our other states, in that we, of course, wanted 5 bronze, 5 silver, and then in most markets we had 2 or maybe 3 gold offerings, as it, sort of pertains to what the actual market wants and what they need. So we found that overall, even though we did have to sort of lose some plans that had some popularity, overall the user experience, the broker experience, I think was a net benefit to members, to brokers. Just easier to understand. Each plan is also, you're forced to have them be a little bit more distinct. So the selling process overall we found a lot simpler, and we found very little difficulties with members understanding why their plan was changing or anything like that. And maybe that was because everyone had to change, but we were all fairly pleasantly surprised with that. Same thing goes with sort of the RX deductibles were slightly different on some plans as well. That didn't really factor in a huge way, just because the changes were fairly small. State-based exchanges still continue to kind of lead the way. So Virginia moved to state-based exchange. Georgia is doing that for this year. It's kind of the second year they've pushed it back. It seems like this will be the time that they're doing it. Of course, it doesn't seem like Ohio is moving in that way, but always important to note, if you do sell across states, sometimes there are additional licensing requirements, which can be quite burdensome. And then, as I mentioned, we did a lot of service area expansion last year. So we added a county in around Columbus. We added the 4 counties around Cincinnati as well. And that's kind of mimics what we've done in other areas as well, some of which were actually borderline, I would say, rural expansion, where, maybe it's not a huge market, but there were only, 2 or maybe 3 carriers that were available in some of those. So we'll continue to do that next year as well. And then just kind of as a reminder, who our vendors are. So we use CVS Caremark. They don't actually manage our formulary. We actually made our own formulary internally, but we use the CVS Caremark sort of network. So that's CVS, Target, Walmart pharmacies, hundreds of mom and pop throughout the state, just to make it easier. So really good in terms of breadth of their network. Optum is our mental health benefits manager. So do get some questions around this where, if there is a sort of mental or behavioral health therapist or doctor that isn't a network, we're utilizing this Optum network. So we don't have as much flexibility to add someone, for example, but again, quite good in terms of breadth on that side. And then we just have pediatric vision available on our plans. And then we added Quorum and Option Care Health as home infusion services. And then for the last few years, we've had both Quest and LabCorp as the preferred in-network lab partners. So around the sort of market highlights, no changes to our Cleveland area and our joint venture with the clinic. Again, we are sort of beholden to where Cleveland Clinic has hospitals, right? So, even though we would love to, and I'm sure the product would do incredibly well if we were to expand, we'd have to basically wait for Cleveland Clinic to buy another hospital. So that's kind of the only thing that kind of prevents us from expanding on it. If you remember, they formerly bought over Mercy Medical Center just over a year ago. So we've included that, and we've seen some good traction in those sort of more outlying areas of Cleveland. And this continues to be a really, really strong product. Good brand recognition as well, obviously holding the Cleveland Clinic too. And that continues to be the service area overall. And then Columbus. So you remember last year we did away with the sort of tiered network option that we had. It just wasn't as popular as what we would have liked. And we really wanted to drive affordability with our sort of narrower network option around Mount Carmel. So again, well-known network. We cover the vast majority of the Columbus metro area. And if you remember, we actually added Hocking County last year. And also, I got an email 2 days ago where we are adding a Memorial Hospital, and I believe that's in Union County. So they coming on board, they'll be in network, and that's starting actually from 8/1. So starting from August, Memorial will be in network. They'll start to come up in the provider view search as well. So again, just kind of doubling down on our expansion in and around Columbus. And then also, if you recall, we added the 4 counties around Cincinnati. So that's proved to be a really fantastic expansion for us. I want to thank everyone who helped us grow there as well. We actually exceeded the target on what we expected to have there. And again, we were well priced. We had a very solid, good network product, and then good distribution there too. In actual fact, we're now at a point where before open enrollment, Columbus was just starting to get larger from a membership point of view than our membership in Cleveland. So we're now at a point where, especially with the addition of Cincinnati, since we kind of have those as related or the same network technically, we are much larger than our Cleveland area. So that's kind of become our sort of main success story actually in Ohio. But obviously having that relationship with the Cleveland Clinic, very, very important to help us kind of for the brand presence and the responsibility of that to grow into other parts of the state as well. And we'll continue to do so going into next year. Not sure which counties we'll be adding just yet, but we'll more than likely have more info, I think August, September, the latest. On the plan and benefit spotlight, I just wanted to touch base on just kind of a few things. And these were sort of predicted to be the most popular or were adjustments to most popular plans, and they really tended to actually show that. So, for example, our elite plans, our bronze elite plans, they're only available in Columbus and Cincinnati. These continue to be incredibly popular in this area and also, frankly, in other states too. So, really great for members who have, want upfront medical costs. They don't have any specialized RX needs because there's a separate RX deductible, but they like having the copay. They might only see a specialist once, maybe twice a year, but in general, they tend to have fairly low kind of needs from a medical side, but they want something, worst case scenario, if something would happen, they like to know what the copay would be going forward. And so we've seen this become very, very popular. In Cleveland, our most popular plan is still the Bronze Classic PCP Saver. So we launched this as kind of an entry-level bronze product, but still has PCP benefits. So again, folks who, your day-to-day, if you do, get flu or something like that, it's fairly affordable to go to your PCP, and you aren't going to your specialist for anything that's kind of routine or anything of that. So, but then you have the access to the Cleveland Clinic if, you needed a specialty or anything like that. So we've continued to see this plan be very, very popular and much more popular actually than the regular Bronze Classic, which is slightly more affordable. But with the cost savings and the PCP here, we've seen a lot of membership move towards this plan. And then in both markets, we have the Silver Simple PCP Saver. So this is basically the one size fits most plan. And it's kind of works for anyone who's receiving a subsidy that's on exchange. There's other two plans. We see a lot of those off X as well. This Silver Simple PCP Saver is the most popular on exchange plan. So again, this cost share reduction. So obviously the deductible, the primary care go down as well as the subsidy increases too. And it's kind of just very easy to follow, a good plan for folks that are on exchange and receiving a subsidy. For example, here's a CSR 200 version of this. So we see how the deductible goes to $600. PCP is only $10. Urgent care is $50. So there's a lot in the way of kind of, if someone's receiving a subsidy and they're between that 100, 220% of the federal poverty level, this is more than likely the plan to pick for them. From an Oscar app and account creation side, I just wanted to touch on this because, we definitely see a correlation between account creation, member retention, broker retention as well. So one of the reasons why we sort of push this as well is it really allows for having that Oscar experience. So folks can pay their monthly premium, they can search for in-network care, they can, secure message their care team, which is really nice to be able to do, for non-time sensitive matters. And then you can also, there's a cost estimator that we launched last year. There's, of course, the virtual urgent care that I mentioned. So really at a basic, I implore all brokers should have their members at the very least create an account and download the app. That's the only way that they'll actually have the sort of genuine Oscar experience. And if they aren't sort of app savvy or they don't love the idea of that, a lot of the functionality is also available on the website as well. So they can do most things very similarly as well online too. I think the app is an easier experience. It's frankly as easy as using an Uber or DoorDash or anything like that. But if they choose not to, the website also has some very, very solid functionality too. And then on the pharmacy side, always want to sort of plug our Tier 1A prescriptions. I mentioned that we developed our own formulary last year, 2 years ago now. And that was so that we could launch this $3 drug list. So we actually identified the bulk of Oscar members had either been prescribed one of these drugs or could potentially switch to one of these drugs. So it's a pretty diverse and large list. It's nearly 100 drugs, almost 300 variations. There's branded insulins on that as well. And the nice thing is as well, from a selling feature, this is basically available on all plans except for catastrophic. So there's no sub tier or anything like that. They're always $3 or less depending on the CSR. And so very, very strong kind of day one benefit that we're able to offer. And then I want to speak just kind of on the support side, what we have, and then I'll just kind of touch base also on ICHRA too as well. Don't know if a slide prepared for that, but worth discussing. So of course, on your day-to-day matters, we have a broker support team. They're based in our hub in Tempe, Arizona. They work from 8 a.m. Eastern to 8 p.m. So they actually have expanded hours. And they're kind of going to be your go-to for, if there's commissions inquiries, you can email brokers@highoscar.com. They'll look up any kind of issues with that, your appointment status, or, if you're having to adjust something, maybe your address or whatever it is that you're having trouble with on the portal. These are kind of your day-to-day folks. And then that 855 number is, of course, there for more time-sensitive matters. I obviously largely lead the individual space. We've actually just launched our own internal ICHRA team as well. So we have actually 4 colleagues that are on that team. We have them to specific areas. The gentleman that takes care of Ohio, his name's Andy Meller. So he'll be kind of your contact for ICHRA specifics. And we genuinely feel like this is kind of the future of the ACA, and the expansion of Oscar as well is directly linked to ICHRA and working along with partners and having preferred platforms that we work with and a few other matters. I know that that's something that Cornerstone really care about as well. And so us too on the carrier side we're actually implementing a specific team around ICRA. So if you have ICRA cases, they want OSCO, we think that OSCO will be a good mix. Feel free to reach out to me, and we'll warm introduce you to that ICRA team as well, so that you're taken care of there too. So that's all that I had prepared. Wanted to keep it a little shorter and to the point if possible. Please take down my email if you have any questions on the individual space. On the ICRA space, I can also help out and get you to the right people as well. So thank you so much for the time, Jeff and Brad, and open to any questions if anyone does have.
Yes, by all
Thanks,
means,
Jared.
if you have, yes, thanks, Jared. Thanks, Jared. And, by all means, if you have any thoughts, comments, questions, please put them in the question box. And we do. Thanks, Aziz. Question: do residents in Columbus, Ohio, have access to the Cleveland Clinic? That's a great question. That's a great question.
Yeah, it is a good question. They do not, no. So the arrangement with the Cleveland Clinic is actually a joint venture. So basically, we can only work within the confines of that venture, and so
Okay.
you have to live within that service area in order to access the Cleveland Clinic. We actually had that product right
Right.
before. We had a
Hmm.
tiered network that included it, and the additional price, we just didn't see a lot of. We didn't see a use case where that actually worked for a lot of people.
Okay. And you are seeing significant growth in the Columbus market. So, can you maybe speak on that? Can you tell us more about the success of the Cleveland market? Which plans are selling well?
Yeah, sure. You mean in the Columbus market, right?
Yeah, Central Ohio. What's really
Yeah,
selling up
so
there?
I think the big thing in it there was, we've priced very competitively. We've had a relationship with Mount Carmel for some time now.
Hmm.
We've also been there long enough to kind of understand what the risk pool is too. So we actually didn't even attempt to be lowest cost. We weren't trying to. We usually try, at least in Central Ohio, we're always aiming to be sort of like second lowest cost. And it seems like, whatever happened with some of the other carriers, they tended to outprice themselves. I think, some adjustments in the market were needed. Um, and another thing that we're also seeing too is kind of, we're still seeing a little bit more of a push into bronze. We have a lot of very good bronze offerings, like those elite plans, for example. So I think those have also helped us to expand pretty considerably there too. And then also, when it comes to, the counties that we expanded into, we're becoming more and more of a sort of household name in the Columbus area as well. So, it took a couple years for, people or brokers to kind of trust us down there.
Hmm.
And I also think the association with the Cleveland Clinic has also helped us immensely with that too.
Okay, and just a couple more questions here. Nationwide Children's. At one point, I know that was in network in Columbus. Um, is it still a network or?
Yeah, Nationwide Children's is not in network, unfortunately. Yeah,
Okay.
so it was for a number of
Okay.
years. Then we had it in that more expensive tiering. We basically, what they wanted from a rate perspective, to be frank, basically was a drag down on the rest of the product. So, for example, we could have them in network, but then, you second most expensive plan, right? So
Oh, yeah, they're like
we also,
children's down here.
yeah,
Mhm.
unfortunately so. And we'd love to have
Mhm.
them in network again, but the net benefit to our membership was better to actually not include them, at least for the time being.
Just to piggyback on that, lots of questions about network, and obviously your team works really hard on trying to expand things in Ohio, and maybe in your crystal ball, at some point, will you see Ohio State or maybe even Ohio Health in
Um,
Columbus?
I don't think so. So as I mentioned, we added Memorial Hospital, right?
Oh, fantastic.
That's, we're always looking to add, if it makes sense, right? So if we were to add something like Ohio State, unfortunately, a lot of those university networks are very expensive, and then again, you hurt, all the other members that are going to have a 25% increase, next year. So
Right,
we're always
right.
trying to add breadth to the market, and
Hmm.
that's why we work with, folks like Memorial, for example, really helps us out in Union County as well. We
Mm-hmm.
had added Hocking County last year as well. So
Mm-hmm.
we always try to add breadth, and try to do kind of what's best in terms of a physician count. But
Mm-hmm.
that might sometimes mean not having the sort of brand name hospital in, at least for the time being.
And if you folks have any questions about the Oscar Network, um, by all means, access their provider finder, or you can call me, and we'll look it up for you. And
Yeah, I'm not
Brad,
seeing
any?
no, I think what Jared reviewed was great. It's great always to know for the brokers, especially those who are new, what the top written plans are. That kind of helps them narrow down when you see a basket of so many. So that's good to know. I also really like the $3 RX copay. That's helpful for so many people for the most commonly prescribed medications. So that's really great. Thanks for that, Jared.
Any questions around Cincinnati or anything like that with this kind of expansion or anything with that in particular?
I think there's a tremendous amount of potential in Cincinnati, and if memory serves me, you guys have, is it Mercy Health or is it
Hmm.
okay, Mercy
Yeah.
Health, and they're one of the largest hospital systems in the country, and ranked in the top 15 of hospital systems nationwide. So there's tremendous opportunity in Cincinnati. And additional question here asks if the doctor search um, at the doctor search it says not accepting new patients. Does that mean the existing patients who sign up for an Oscar will not have their plan accepted at the doctor's office?
Yeah, so basically that's sort of carrier agnostic, right? So it doesn't matter
Yeah,
which carrier they're with, as long as it's
yeah.
an existing patient, then that's fine.
Okay, okay. So if they're an existing,
Yeah.
they'll be fine. Okay. All right. Thanks for that clarification. Yeah, I think you guys have a tremendous product, and you've got the foot on the gas. And one comment from one of our astute agents, and believe me, they are the best in the industry. He says Oscar has TriHealth, perhaps.
We
Look
have
into that.
try health.
TriHealth.
In Cincinnati. As a matter of fact, I was just
Cincinnati.
reviewing a sort of a cheat sheet list that we made up, Jared, and that was one
Yeah. Is it
that
on
I
the?
saw on the list we created, but
Hmm.
Yeah,
I'm not
Cincinnati is
sure if
always
that's accurate.
always confusing because every hospital has a different name to it.
Well,
So
yeah, that's like Bethesda and Good Samaritan.
yeah, so we definitely have. Look, we have UC.
Okay,
Um,
UC.
so UC is in there, and then I'll tell you now, just so I know, because I work up kind of the hospital name itself. I know the systems usually have their own. So let me just pull it up just to make sure.
Yeah, if you wouldn't mind, that'd be very
Yeah,
helpful.
no problem.
And I'll give you a zip code if you need it.
So in Butler County, we have uh, Bethesda,
Yes.
um,
Mm-hmm.
Hyde Memorial,
Mm-hmm.
Westchester,
Mm-hmm.
and then we have Good Samaritan, Bethesda
Mm-hmm.
as well, Daniel Drake,
Mm-hmm.
UC, and then Bethesda
Yes.
North. And,
Fantastic. Those are great. So TriHealth is an outstanding system in Southwest Ohio. And if you wouldn't mind, could you check out Hamilton County, which is, where Cincinnati is located?
yeah,
And
did you say Hamilton?
yes.
Good Samaritan, Bethesda, Butler Hospital, Drake, Daniel Drake Center, obviously the UC Medical Centers
Yeah.
there as well, and
Okay.
then their North Hospital too, Bethesda's North
So,
Hospital.
so fantastic. Bethesda North and Good Sam, two very highly sought after hospitals here in Cincinnati. Um, did a great job. I think we had some fantastic follow-up questions. And by all means, if you guys have any questions about the Oscar program, let me or Brad know, and everybody will get a copy of the presentation. Brad, any final thoughts?
No, and I think now I could see with just talking about the Cincinnati network, having that been added along with Columbus helps push. Jared, that was actually very interesting that you said that sort of the central southwest Ohio is overcome the Northeast Ohio market, which has always been your core market. So that's very
Mhm.
interesting. Very
Yeah,
interesting to
and
hear.
frankly, we can't announce new counties yet, but that's definitely where we're looking to expand additional counties.
Okay.
Do see a world where Columbus and Cincinnati join at some point, right? We have like a corridor. Is
Yeah.
that 71? I guess would be 71 corridor,
Yeah.
Hmm.
something like
Yeah.
that. Yeah. So I could see
Yeah.
a
Yeah.
world where that is what we're looking at expanding. Obviously, I don't know if that works this year or the year after,
Hmm.
but kind of creating a solid, subgroup there. And it really is its own region, right? That's
Hmm.
another thing with the Columbus going to Cleveland. We just didn't see many folks where that was actually a feasible thing to do, right?
Yeah.
And so but Columbus and Cincinnati, that whole region seems to kind of work together a little bit more, even from a distribution point of view. A lot of the brokers that we work with seem to, they are focused on that region. The Cleveland brokers are the Cleveland brokers, right? So
Hmm.
I think that's at least what our experiences has been of late.
We all know that a Cincinnati resident cannot go to the Cleveland clinic because the clinic is a separate plan. But by the same token, could a Cincinnati resident travel up to Mount Carmel in Columbus and vice versa?
Yes, it's the same network technically. So you
Okay.
have to live within one of those service areas, but yes, you
Yes.
you technically can interchange that whole network. Yeah,
Okay.
it's
Great.
one license
Excellent.
essentially, right? So one
I
insurance
see.
license for one product. Yeah.
That's all I got,
Yeah.
Jared.
That was good. I know this is sort of a mid season touch point, but we just definitely wanted to make sure that we had you on, Jared, so we didn't want to miss a cycle with you. And we'll look forward to the 2025 updates come, well, hopefully by October, maybe even September. So we'll uh, we'll start scheduling that. So everybody on the call, look for that. Actually, not only Oscar but all of our carriers, we're going to actually start scheduling those here very soon as we get closer towards the end of summer. So it will be a busy third and fourth quarter this year for everybody that works in the ACA and the Medicare market with everything going on over there. So hang tight, have a good summer, get your rest. You're going to need it for then. So that's all I
Thank
had.
you so much,
Just
Chris. Thank you for having me. Thank you everyone on the call
You
as well.
bet.
yeah,
Everybody have a
you
great
got it,
day.
Jared. Yeah, thanks so much, everyone. Take care. Bye, Jared.